I suppose the logical place to start is when I was diagnosed, or what led me to get diagnosed. Round about October, I would say 2003, I started moaning at my wife that I had continual bellyache. Now, she will say that I'm always belly aching about something or another for no apparent reason. But she said, well, why don't you go to the doctors? And I'm a man, I don't go to the doctors. Anyway, she nagged and nagged and nagged, and eventually, after about 2 or 3 months, I went to the doctors and said, I've got this continual tummy ache, which I can't quite get rid of. So he, first of all, put me on omeprazole for a couple of weeks, a couple of months. Didn't seem to achieve anything much. And I happened to mention when I was on the way out of the surgery one day that I was feeling tired all the time, and he said, come back in, sit down, and we'll give you a blood test. And he was so alarmed by the results of the blood test that he thought, he rang and left a message on the answering machine saying, come in at once, you must be suffering from internal bleeding. And so I went in the next morning. I got an immediate appointment with him, and very soon began the series of investigations at my local hospital in Croydon, which led to my being diagnosed with GIST. And fortunately for me, the consultant wasted absolutely no time referring me directly to the Royal Marsden. That was April 2004, and basically since then I haven't looked back. I've had very good treatment. I've had total faith, total confidence in what I was being told, in what I was being recommended to do, starting with being put on imatinib, Gleevec, and it just took it from there. Basically, I had a primary GIST only about this big in my jejunum, which is just below the stomach, and I also had a much bigger, about a 22 centimetre secondary or metastatic GIST on my liver. So I was already, at the time of diagnosis, a metastatic patient, which meant that basically it's not curable, but it is treatable. And at the time, imatinib was a new drug. No one really knew how it was promising, but nobody really knew how well it would work. And so they gave me between 5 and 8 years to live. Not the Royal Marsden, I had to have the consultant who diagnosed me. So basically, if those sort of information is to be believed, I should have been pushing up the daisies from about, the last 4 years or so at least. But for some reason I'm still here, and I count myself quite lucky in that respect. Now, so after about a year, I got very good shrinkage with Gleevec, imatinib, whatever you want to call it. It works. And after about a year, I went to have my liver resection. They got both the tumours clean out, and that was me free of GIST, apparently, for at least the next year or so. They continued me on Gleevec for about a year, and then after that it ceased, and I went another 6 months before there was recurrence. So again, that came as a little bit of a, I suppose I just want to roll back to when I was first given the cancer diagnosis, because I guess like all of us, we didn't know how any of us would react when we were actually given a cancer diagnosis before we actually had one. I thought it would be something dreadful. I thought I would probably kind of collapse into a heap. But I found that my reaction surprised me, and I thought, oh, I've got cancer, I wonder what happens next. And I just wonder if that's how anybody else experienced it. Was it just total dread? You don't have to answer the question. I just wonder what I can't be the only one who went through a mixture of positive and negative emotions about being given a cancer diagnosis. One thing I did know was that I was a father of a wide variety of children, because I've been married twice. One was a stepson. One was a daughter by natural birth from my first marriage. And I had also, not very long before that, adopted a daughter who was then about 3 years old, and I wanted to see her grow up. So I had all those emotions going on, and I think that I wanted to see all of them grow up and see what they did with their lives, although my stepson was by this time already 30. He's 40-something now. My daughter from my first marriage is also grown up and has since presented me with a grandson who's now 4. No, he is 3. But the point I'm making is, although I got the cancer diagnosis, and it obviously meant that my life was changed from the point of view of I've now got to go every 3 months at least for a CT scan. I've got to go and then a week later roughly for an appointment to see how the scan went. That doesn't alter the fact that I was still a husband, I was still a dad, I was still a son to my mother, who was still alive at that time, and I still had a job to do, in a professional sense. And I've since become a granddad. And those things don't change. And what I have found more useful than anything throughout the time that I've been treated is not to think of myself as just being a cancer patient, but to say to myself, well, for all my life, I have been me. I have been Michael. That is the name that my parents chose for me. It's a name that I am pleased that they chose for me. And I'm also very pleased that I have been all these things, a husband, a father, and now a granddad. And that to me means more than, and of course I'm an uncle and all this kind of stuff as well to other people, means more than being a cancer patient. So I would encourage everyone here, whether you've been diagnosed last week, last year, or even longer ago than I was, to hold on to what is important about you, about being you. Obviously, as a cancer patient, there have been lots of ups and downs. But there's been lots of ups and downs in my other personal life. No relationship with your children is ever, or even with your wife, in my experience at least, is necessarily all up and no downs. And the relationship with cancer has been, as the title of this talk suggests, also a lot of downs, as well as, but in my case, maybe fortunately, I don't know if I'm lucky or what, but there's also been a lot of ups as well as downs. Fortunately, the ups seem to be more, take you up higher than the downs take you back down again. Anyway, to return to my story, like I say, after a year I had the operation, and was basically just free for about another 18 months. Then it came back. And they put me back on the Gleevec, and it continued to work for me for another few years. And altogether, from diagnosis in 2004, it worked for me until October 2011. Now, there was a slight little blip in the middle of that. In 2009, they discovered what they called a nodule on my liver. It was within a tumour that was in my liver being controlled by the Gleevec, but this nodule was beginning to grow out of that. And so they sent me along for radio frequency ablation. Now, who in this room doesn't know what radio frequency ablation is? Put your hand up, feel free. Right. What it is, what they do, is they put you under general anaesthetic, I hasten to add, into a CT scanner, which then gives the practitioner, the radiologist, a clear view of what he or she is doing in your inside. They then put a kind of a probe, a needle, through your body wall, straight into the offending tumour. And at the end of the thing that they've put into you, there is kind of like electrodes or something, which basically produces like microwaves in a microwave oven, heats up the tumour from within to about 60 degrees centigrade and kills it off. Now, it can only be used at present on smallish tumours, and it depends on location, and you can't really risk it if there's things like vital blood vessels close by and all this kind of thing. So it's a little bit limited as to where you can use it. And of course, if you heat it too hard or for too long, because it's a larger tumour, you risk doing damage to the surrounding tissue and surrounding organs. So it's a bit limited in what you can use it for. Nonetheless, that kept just at bay, combined with the Gleevec, for another 2 years. Then came the dreaded news. I don't know how many people have been on Gleevec, had it work for a while, and then been told it didn't work anymore. Only 2 of us? 3? How would anyone who's been on Gleevec, who it stopped working for, would like to say quickly what they felt about it when they heard it wasn't working? Yes.
It was a very good drug, kept me.
What was it like when he wasn't working? When you were told he wasn't working? You were upset.
How did you feel when you were told it was no longer working?
Well, it's obvious, upset, but...
and then they said you were got to go and suit it.
Yeah. Right. So, Gleevec done a lot of good thing for you. Give me a life.
Yes.
That's what I say. Because without Gleevec, I wouldn't be here today. Because that was the option I had. Because I had 2 open surgery. One was successful, but the other one just opened it and closed it and said, there's nothing else we can do. So the Gleevec was, when I was told that there is a drug, never mentioned the name, but when they gave me was Gleevec, and I went on a Gleevec. There was difficulty of side effect, obvious, but I manage every side effect. And then I live on Gleevec for 6 years. and 3 months. And apparently the tumor, liver became immune to the tumor. So then I went on a shooting on 2010, and I'm still on a shooting now.
You were upset.
So upset, and
When liver didn't work.
the liver didn't work, and then I didn't know what to do. But then I was suggested that we try on a shooting. That was the only drug available, and I was and I'm still on a shooting now.
So has the Sutent lasted longer than worked for you longer than the Gleevec did? How long did Gleevec work for you?
6 years, maybe.
Yeah, and it's 6 years now.
Yeah, 6 years.
I mean, I think 6 years is an exceptional amount of time for Sutent to work. I mean, at that stage, I was put onto Sutent. And I was immediately suffering. What did I do? Well, I basically spent the next 3 or 4 months doing almost nothing but limp on both feet. It wasn't quite like walking on glass, but it wasn't much less comfortable than that. It was still unpleasant, and I was walking very slowly and thinking, is this what I'm really going to go through for the rest of my life? However, I asked about having a second liver resection, and the Royal Marsden said, and I think quite rightly, that it wasn't advisable. It would be too risky. And after making other inquiries, I went back to the original liver surgeon who they referred me to back in 2005, and then because he was a liver surgeon primarily in a separate hospital down in Basingstoke. So I just contacted his secretary and said, "Can I speak to Mr. Rees again?" And she immediately remembered me. I was amazed. And the long and the short of it was, he got on the phone to me and we had a discussion, and he said, at the end of the day, if I was your brother, I would say, yes, it is risky, but go ahead. We will do this and we will get you through. And obviously I'm still here. I had the secondary resection in March of 2012. And it transpired after that the Sutent, for all the suffering it had put me through, hadn't made any impact on the tumour whatsoever. However, once again, I was free of gist, technically. No evidence of it, no visible evidence. Then I kept on the scans. They recommended that I didn't take any drug, which was a great relief. I felt better than I've any stage during the whole time that I had gist. I felt normal. No sore feet, no running to the toilet every 5 minutes, no cramps, no nausea, nothing except feeling totally healthy. It was like I'd gone 20 years younger. And then August 2013, I got the news that I needed to go on to regorafenib because an earlier scan back in May had revealed that the disease was back. This time, of all places, I had a new tumour in my right gluteal. Anybody know what the gluteal is? Anybody not know what the gluteal is? Well, I didn't know. It's your bottom muscles. And so the Royal Marsden sent me down to their biopsy department. We were very, I don't know if I ought to say this in front of Audrey, but quite an attractive nurse got me to get my trousers off, face down, face down on sort of an examination couch, and to cut out all the details except the vital ones. Stuck a needle in straight into my bum and pulled out a plum. No, she pulled out a bit of the tumour, and it was biopsied. And I mean, I remember thinking, bursting out laughing while this was going on, because I thought, if I don't, this is such a ridiculous thing that I'm going through, you know. I had to laugh because I thought otherwise it's just so humiliating. But it's not. It wasn't. It was just very funny, and the thought that what they were doing just made me laugh. And the biopsy came back. The confirmation came back soon that yes, it was indeed a gist, as were the other gists. And so the other, they found by this time that I had them all over in my tummy and on my liver. And so I commenced regorafenib with a lot of trepidation, because I thought, well, the Sutent didn't work. What's the regorafenib going to be like? And I soon found out. Within about 12 or 13 days of starting on regorafenib and not noticing anything, all of a sudden I had a big blotch right up my back, looked like severe burns. I told the Marsden, Audrey took some pictures of it. We took them up on the laptop, and they said, have a break from the regorafenib straight away. And since then, it's been a real exploration as to how I was going to get the regorafenib to work for me, because the foot syndrome with the regorafenib, which was also something which I've suffered, was just as bad as the Sutent had been. And once again I thought, oh, am I going to be like this for the rest of my life? What's left? It felt like this is really the last chance saloon, and it was going to be a pretty dire last few months or however long it was going to be. And as David Faulkner was talking about this morning, I was the ultimate in experimentation with with dosage variation, cutting it down. I eventually hit upon a dosage which is still working for me in the main, and keeping the tumours under control. And we are now, 2.5 years down the line. Now, I don't think it's very useful for me to say this is what worked for me, because anybody else, I think it's best for anybody else who gets put onto regorafenib, or indeed sunitinib, to find out what works for them, rather than be guided by what I find works for me, because we're all different. Anyway, so the regorafenib, I've eventually hit upon something which works. The side effects are not too bad. I get the odd sort of problem with my one foot or the other, or both sometimes, but it doesn't usually last very long. And ironically, when I get the 7-day break, that's sometimes when it peaks a bit. It's almost like my body misses the regorafenib kick, and but then it eases off again, but as I move towards the next cycle. And then, not very long ago, I noticed that I had some sort of discomfort in this sort of area, on my ribs round the back. And so I went to the Royal Marsden, and they said, that could be a tumour pressing against your spinal nerves. And so they gave me an MRI scan, and it showed that one of the tumours was near my spine, was getting out of control. The regorafenib was still basically controlling the others, fortunately. But this rogue tumour was just getting, it had only gone to about this big, and the MRI picture showed it very, very clearly. And it was about, I suppose, 2 or 3 centimetres away from my spinal column, towards the bottom end of it. Anyway, because they said, what we'll do is we'll give you some radiation treatment. And this all happened incredibly quickly. I was sent down. Within days, they had done a special CT scan to locate exactly where this tumour was that was causing me the trouble. They called it I think they called it a targeting CT scan. It was done down in the radiotherapy department. And what they do during the scan is they look at the pictures live, and then the radiologist comes out when he's got an exact location and does a little tattoo, a tattoo dot. He uses a sort of a sharp instrument to mark it. An exact dot marks the spot, and that which the radiotherapy people subsequently used to line up the radiotherapy, the machine, which is, I don't know if anybody in here has ever seen a radiotherapy machine, but it's really quite you can't really describe it, but the best I can do is, it's like a great big thing which comes arching over the top of you, and at the end of it is what I would describe as the sort of thing you see in ladies' hair salons for drying the hair. Big round thing. Anyway, to cut a long story short, that happened on the Monday of the week, and then on the Wednesday I commenced the first of 5 days of going in for radiation therapy. They used the spot to line up the machine. It kind of comes down low over you, hovers above your tummy for a little while, doesn't do anything. Then they all clear out of the room, like rabbits running from the farmer, and it makes you feel very confident that it's safe. And then it comes down the side of you, a bit like some science fiction film, and it makes a little kind of, you have to lie stock still on this while it happens. And it goes quite quietly next to you on that side, and it goes over the top of you. You feel like you're being watched by some robot, and then it does the same on the other side when it's got lined up. And I went Wednesday, Thursday, Friday, and then Monday, Tuesday. And that was literally finished a week or 2 ago. And the achiness in my back has gone. And although I won't know the actual results of that until I go for a scan, a normal CT scan on the 12th of March, which is a Saturday, and I get the results on St. Patrick's Day, the 17th of March, and that's when I'll really know how effective the radiation treatment was. All I can say is that although I had a few days of being up and down like a yo-yo, as opposed, in terms of feeling totally exhausted and run down, now, just over 10 days later, I'm feeling pretty much back to normal, and much happier about things. I'm still on the regorafenib. I'm getting very few side effects, and that, in a nutshell, is my story up to date.